Morning, everyone. Let's start. Welcome everyone to this special webinar on World Hepatitis Day. I am honored to be your moderator for this very important event. Today we are gathering here to raise awareness about hepatitis, which is a global health concern that affects millions of people all around the world. As we begin, I would like to take a moment to highlight the significance of this day. World Hepatitis Day, which is observed annually on every 28th of July, it aims to bring attention to the global burden of hepatitis and promote actions to prevent and treat this viral infection, which is affecting millions. Today, we're partnering with the Mater Hospital, and we have a very distinguished speaker who will be sharing her knowledge and expertise on various aspects of hepatitis. We will be discussing its causes, symptoms, and available treatments, and also how we can together curb the spread of hepatitis. Throughout this webinar, we encourage active participation from all attendees. Feel free to ask any question, share your experiences, and engage in discussions. Let's utilize the chat section also to send out our questions. Let's make the most of this opportunity. And I would like to ask my colleague, Brenda, to start us with a word of prayer as we begin. Welcome, Brenda.
Let's pray. Heavenly Father, we come before you this morning. We thank you for the gift of life. We thank you for the gift of yet another day. We thank you for this session that you've blessed us with and this time that you've planned for us to gather and enhance our knowledge and get to know more about hepatitis. We pray that you will be with us, guide us, help us understand more, help us know more for our sake and also for the sake of the people we share our lives with. In Jesus' name we pray.
Amen. Thank you, Brenda, very much. We're going to start by just a small intro on what Britam is all about. Britam Group Holdings is a leading diversified financial services group, which is listed in the Nairobi Securities Exchange and with a presence in 7 countries in Africa, that is Kenya, Uganda, Tanzania, Rwanda, South Sudan, Mozambique, and Malawi. We offer a wide range of financial solutions in life assurance, general insurance, health insurance, retirement planning, asset management, and property. These solutions enable our customers to protect and grow their wealth and achieve their financial goals every step of the way. Our purpose is safeguarding dreams and aspiration with a vision to be a leading diversified financial services company in our chosen markets across Africa. Our mission is providing you with financial security every step of the way, with values of customer focus, integrity, innovation, and respect. We're going to start off our meeting today with a poll question just to engage our audience so that the session is interactive with a poll question. And our first question is going to be shared with you. And it is, do you know anyone who has ever been infected with hepatitis? I'm going to give like 2 minutes so that you share your answers. Okay, so a majority of us, I see they do not know anyone who has ever been infected with hepatitis. And we're going to be introducing our speaker today so that she takes us through understanding what hepatitis is all about. Her name is Dr. Olive Akunga. Dr. Olive is a dynamic physician and a medical trainer with wide experience in the public, private, and local international health spaces. She's involved in the health sector as a frontline clinician, medical researcher, lifestyle educator, health administrator, and training supervisor. She's currently working at the Mater Hospital as a specialist physician in internal medicine, clinical researcher, and program supervisor of resident physicians undertaking the specialty training in internal medicine under the East Central and Southern Africa College of Physicians. Giving back to the community, especially to the less fortunate, is a core part of her life, and she's a member of organizations such as Rotary, St. John's Ambulance, among others. She gets to participate in volunteerism and mentorship that betters her community. Welcome very much, Dr. Olive. We look forward to having a very interactive session. Thank you.
Thank you for that very kind introduction, Jessica. I hope you can hear me clearly.
Yes, we can, Doc.
Great. So I think we'll get right into it. You can just move to the next slide. So today being World Hepatitis Day, July 28th of every year, usually marks the World Hepatitis Day. And one of the fun facts is that actually July 28th is the birthday of the scientist who discovered the Hepatitis B virus. That is Professor Barack Bloomberg. So Hepatitis B actually, a virus that was discovered in 1967 by this gentleman. So in commemoration of that scientific discovery that really has changed the health space, in that before being an unknown virus, it caused a lot of morbidity and mortality. So people sat together and said, look, in honor of this gentleman, every July 28th, which was his birthday, we are going to be marking the World Hepatitis Day. So the theme for this year is Do Not Wait. And in line with the first poll question, interestingly, many people have said they do not know anyone who has ever been infected by hepatitis B. But I dare say that that is actually because many people do not go for testing, and many people don't even know the symptoms of viral hepatitis. And no wonder most of the infections that we catch at hospital level tend to be chronic infections with complications that most of the time, unfortunately, tend to be irreversible. So the purpose of this awareness talk really is to just pass this knowledge on to all our listeners today, so that you're able to tell what are the symptoms of viral hepatitis, how can I prevent myself from getting a chronic infection, when I go to hospital, what kind of tests should I ask for? Should I get vaccinated? What are the risks of getting vaccinated, and so on? So basically the theme for this year being do not wait. Do not wait until it's too late to reverse an acute infection that we can take care of. Do not wait until it's too late and you're dealing with liver cancer. And all of us, and I guess most people on this call, being residents within Kenya, we've seen an increase, even just from social media updates and so on, of an increase, a rise in the number of cancers, and especially these cancers that are attributed to infections, acute infections that can be reversed if diagnosed on time. Then hepatitis B being one of them that can predispose you to liver cancer. Really, I cannot overstate the importance of this stock. So we can move on to the next slide. So usually I like to package my public health messages into something very simple that you can remember by the end of this talk. Really, the point is not to bore you down with scientific jargon, but the point really is that by the end of this brief session, you will be able to know what is hepatitis, what does hepatitis even mean? How can I tell if I have that viral hepatitis infection? You'll realize that I will limit this talk to viral hepatitis specifically, but as you'll see shortly, there are many other causes of hepatitis as a syndrome. But for today, we'll just focus on the hepatitis that is caused by the viruses. How do you get tested for this? What are the treatment options if diagnosed with it? How do you prevent it? I mean, it goes without saying prevention is better than cure. So how do you protect yourself? And if you've been diagnosed with maybe chronic hepatitis, how do you live a healthy lifestyle so that you would, try and delay progression to cancer as much as possible. Next slide. So what is hepatitis? So medical jargon is very simple. Anything that we say itis, hepatitis, many other words that end with itis in medicine. Basically, itis, that derivative, when you see it in a medical term, it basically means inflammation. When you say pneumonitis, it means it's inflammation of your lungs and so on. So for hepatitis, hepa means the liver. The liver, we call it basically the hepatic system. The study of the liver is hepatology. So hepatitis means just basically inflammation of the liver. And how does your liver end up inflamed? Usually many things cause this. It could be physical injury. Maybe you are somewhere, someone stabbed you, or you are in a car accident, and the way we put our seatbelt strap, one that goes across the waist, and maybe you get a lash injury causing physical injury. That can cause inflammation on the liver. Another very common one that we're seeing nowadays is obesity and overweight, which is quickly becoming an epidemic in our country. That is another cause of hepatitis. We are diagnosing a lot of patients with fatty liver, which we call NASH, non-alcoholic steatohepatitis. We will probably talk about that on a different day, but that's another cause of hepatitis. Alcohol use. Alcohol itself has been associated with this injury to the liver, as well as the pancreas, which we call pancreatitis, inflammation of the pancreas. So that can also cause these issues in the liver. Other than that, you have bacterial infections. Many different kinds of bacteria and parasites can also cause this injury. Adverse drug reactions, both prescription drugs, over-the-counter drugs, and even illicit drugs of abuse have been shown to cause hepatitis as well. But for purposes of this talk, we will be looking at viruses and how they cause this. Next slide. So for viral hepatitis, currently there are 5 of the commonest. There are other viruses that cause hepatitis, but for purposes of this talk, we'll focus on the 5 commonest that have been identified thus far through scientific discoveries. And these are hepatitis A, B, C, D, and E. literally following the letters of the alphabet. So these are viruses that specifically attack the liver. There are many other viruses that would attack the liver, but as a complication of a systemic infection, basically meaning that you've gotten a different kind of virus, for example, cytomegalovirus and so on, and they don't attack the liver primarily, but because of this virus spreading within your blood, it can end up getting to the liver. So we will not look at those today. We'll look at the viruses that specifically attack the liver, which are those ones that we've listed. We call them the ABCs of viral hepatitis. So all of these viruses can cause an acute infection. An acute infection basically means a new infection. But two of them, hepatitis B and C, can actually cause a chronic infection. A chronic infection meaning an infection that you stay with in your blood almost for the rest of your life. And the challenge with this is when you stay with this chronic infection, the inevitable consequences, complications from this, the worst of which is liver cancer. Right, I think I was muted there for a few seconds. I think we are back. Thanks, Jessica. So basically, do you know your ABCs? So these are the 5 different types of hepatitis. So what does it mean when you have hepatitis A? How is that different from if you have hepatitis B? What does having hepatitis C mean, and why do we even name them so differently? Why can't it just be hepatitis is hepatitis, you know? So just looking at that a bit, yeah, so the difference in the naming comes because these viruses behave very differently. Like we've already mentioned, some of them will only cause an acute infection that doesn't progress to a chronic infection. But some of them, again, will cause, may progress to a chronic infection and other complications. The way they are transmitted as well is different because there are different modes of transmission for each of these viruses. Excuse me. So hepatitis A, for instance, usually we call it a fecal-oral virus, basically behaving like most of the viruses that cause GI infections, the gastrointestinal infections, the ones that people know commonly are the typhoid, the Salmonella typhi, cholera, and so on. Those are things that you get through contaminated food and water. So hepatitis A is transmitted similarly. When you get access to contaminated food and water, then you're likely to end up with hepatitis A. Usually presents with very high fevers, diarrheal illness, and the only good thing about this is, save for the fact that there is no specific treatment for this, usually it's a self-limiting kind of infection, so tends to reverse pretty fast. For hepatitis B, which will be our focus of today, this one is transmitted through infected blood and other body fluids through means such as, shared personal items like razors and toothbrushes, basically sharps that may have contamination with body fluid and especially blood. Or unprotected sex. This is another common way through which people tend to contract hepatitis B. Again, mother-to-child transmission, especially through that peripartum period, when there's a bit of exposure of the baby to maternal blood, especially during the separation of the cord. So that can also happen. Now, hepatitis B, and why we are focusing on it today is because it's let me say the most risky of these this particular panel of viruses because it is actually the most common cause of liver cancer, and liver cancer is the second leading cause of cancer deaths worldwide. So this is a very important public health effect, and so it is something that being preventable through vaccination is a virus that we really want to emphasize on so that people can prevent as much as possible. Next slide. So hepatitis C, again, transmitted through infected blood, unprotected sex, and contamination using, co-sharing of sharps again. So this also, as we've said, may lead to that chronic infection and predispose you to, or rather predispose the patients to liver cancer. Thankfully, there is currently a cure for hepatitis C, which became FDA approved in the year 2013. Hepatitis D, most of the time patients who contract this hepatitis D tend to have a co-infection with hepatitis B. And the challenge with this co-infection or simultaneous infection with both hepatitis B and D leads to more rapid progression to liver damage and even liver cancer. The good thing again is that just by being vaccinated against hepatitis B, you are able to protect yourself from hepatitis D infection. So the hepatitis B vaccine does offer cross protection or dual protection against both hepatitis B and hepatitis D. For hepatitis E, again, very similar to hepatitis A through contaminated transmission through contaminated food and water. The commonest culprits being pork and shellfish, for those who like indulging in that. So this, again, just to be aware, can predispose you to this hepatitis E viral infection. There is no known treatment for hepatitis E. And there is no approved vaccine yet, but those are still under study, and we hope that in the next few years we're going to be able to have this in our market. So in a nutshell, those are the differences of, how do you contract this, which ones do you contract through contaminated food and water, which ones do you contract through, contaminated blood and body fluids and so on. So why should you care? Because, of course, from the initial poll, many of us don't know anyone who's ever been infected by this. So why is this even useful? So it's a global public health threat. Of course, as we've said, this viral hepatitis can predispose you to development of liver cancer. Liver cancer is very common. Second commonest cause of cancer deaths worldwide. So why is it important? Anything that is preventable, anything serious that is preventable is something that you should care about, because then you can do something about it. If there was nothing you could do about it, then it's an exercise in futility. But if you can prevent it, why not? Secondly, and something that many people may not be aware of is that the hepatitis B virus is actually more infectious than the HIV virus. So when you are exposed to a sexual partner who has hepatitis B and another one who has HIV, your chances of contracting hepatitis B from having unprotected relations with either partner, the consequences, or rather the chances of you getting hepatitis B transmission are 100 times, 100 times more risky compared to the HIV virus. So very infectious again, and something that we need to be aware of from a public health angle. So again, being the primary cause of liver cancer, specifically the HCC type, the hepatocellular carcinoma, then we really need to be aware of this and consider getting vaccinated early, so that then we prevent the chances of contracting this. Next slide. So what are the facts and figures? What's the epidemiology of this hepatitis B? In the world, 2 billion people, which is probably a third of the world population, have been infected with the hepatitis B virus. That's a huge number. That probably means you probably know someone who's ever contracted this or who has this currently. You just don't know of it because probably they've not been tested, or they've not or they've been tested, but due to stigma associated with infections generally, especially within our society, people are not very willing to disclose this kind of information. So 2 billion, a huge number, a third of the world's population. Every year we get approximately 1.5 million people getting newly infected. Of this total number of people, almost 300 million will progress to chronic infection, basically meaning they'll get an acute infection. Nothing will be done about it, or treatment will be attempted unsuccessfully, and they will progress to chronic infection, which may even be lifelong with complications. Approximately 10% of infected individuals are diagnosed, and this is what I was alluding to, that in as much as we are seeing all these infections coming in, very few people actually have the knowledge that will enable them to seek the proper testing for this. And because of this, we have a huge number of deaths or mortalities that result from just this lack of awareness. And an estimated, or even just because you may be aware, but due to complications, I mean, they're irreversible, not much that anybody can do about it. Unfortunately, we end up with about 820,000 deaths from hepatitis B and its complications every year. That, in effect, means that we have 2 people dying every minute from hepatitis B, something that can easily be prevented. Next slide. So, how do you know you have hepatitis B, or how do you suspect if your partner or a close family member, a friend, a relative has hepatitis B? Most of the time, it's a silent infection. Most people will not have any, specific or clear symptoms when they're first infected. So because of this, the transmissibility becomes very high, because most of the time they unknowingly pass this virus to others, and this continues the silent spread of hepatitis B. So the only sure way of knowing whether or not you are infected is through testing. And that's why you'll see, for instance, this talk is courtesy of the wellness department of Britam. And when you're told, go for a wellness check, go for your annual medicals just to know, your health status. How is your liver? Do you have 1 to 3 infections? It's very important to do that. Just so that if you have any issues that can be screened and diagnosed early to prevent complications, then that can be done. So the only sure way of diagnosing hepatitis B and many other medical infections is just by having awareness of it and getting tested for it. Next slide. So the common symptoms of hepatitis B infection, again, largely non-specific, but some of the things that someone might experience is, fevers that you can't attribute to anything else. So you have some hotness of your body, some chills. You feel like you're more tired than usual. You have some joint pains. Your appetite is not so good. You may experience some nausea, vomiting, some stomach upset, some change of color in your stool. Many people do not look at their stool. That is something that, again, from a medical angle, we encourage people to do. Don't just, do your business and flush. It is good to know the regular color so that when it changes, you're able to flag it, because trust me, it's not just for the hepatitis. There are many, many other issues with the intestine, including even colon cancer, that you can tell simply by knowing the color of your stool. So that when there's a change, when there's blood, that color change that we're referring to, you're able to pick it early and be able to alert your physician. Other serious symptoms that you may experience would be like yellowing of the eyes. Sometimes they appear yellow or almost a yellow-green color. That is not normal. We call that jaundice. Again, a sign that the liver is having a problem. The other things would be a bloated or a swollen stomach, sometimes due to change of size of the liver. Next slide. So if you get a new infection, what we call an acute infection, usually that may last up to 6 months. Before then, you test positive, and within 6 months, it reverts back to a negative test. So usually that would take around 6 months. During this period, the infected person is able to transmit the virus, and we've already gone through how this is transmitted. We normally diagnose this through a blood test. I will not go into the details of the specific blood tests that we do, because then that becomes very scientific, and the best way is to go to either a specialist physician or a liver specialist who will be able to know which right tests to do and how to interpret those tests. So even in terms of where you go to get these tests, on what kind of tests are done, then you need to know to go to the right kind of specialist who will be able to tell this is what is going on with you, and for this particular one we can treat or we cannot treat, or this is the best way forward. So once you've been diagnosed, periodically your blood will be tested over this 6-month period until a point where the negative test is noted, and then you'll be assured that the infection has completely resolved. Next slide. So when it progresses for more than 6 months, you've been diagnosed today, 6 months from today, or 7, 1 year, 2 years down the line, when you're tested, the test is still positive. That one now we call it a chronic infection. When it doesn't reverse within 6 months and you continue to test positive for hepatitis B, then we say you have progressed into a chronic infection. So this basically means that your immune system was not able to get rid of this virus, and it remains in your blood and in your liver. So another interesting thing is in most of the time, development to chronicity, progression from an acute infection to a chronic infection also depends on the age at which a patient is diagnosed. For instance, the babies who get this infection through mother-to-child transmission, 90% of them, unfortunately, will develop a chronic hepatitis B infection. For the children who get this infection, when they are between the ages of 1 to 5, they will progress to a chronic hepatitis B infection. And this basically means that they will have a chronic liver disease. Because of this, you'll hear us emphasizing a lot in the hospital, bring your children for immunization. Of the immunization that your babies are getting, be very clear on what vaccines they are getting, because sometimes parents just bring them, they are vaccinated, you don't know which vaccine they were given, you don't know what is contained in that vaccine, you're told it's a pentavalent or a hexavalent, you don't know what that means. So you're not able to clearly tell what your child has been protected against. You're not able to ask the right questions. So it's very important if you're on this Zoom call and you have children around the age of under 1 when they are getting their vaccines, it's important to know exactly which vaccines are they getting, so that you know what benefit as far as protection is being conferred to the children. Because if they miss out on the important vaccines, one of the most important being this hepatitis B vaccine, then their chances of infection increase. And once they get that liver infection, highly likely, 1 out of 2 chances, they're going to end up with a chronic liver issue. For the adults who get this infection, up to 10% will end up getting the chronic infection. Meaning the good news is there's a high recovery rate, because if only 10 progress to chronicity, it means 90% get healed. Now, the problem with the 10% who get it, out of this 10%, 10% of them will end up with liver cancer, inevitably, right? So again, a big call for adults to also get vaccinated against hepatitis B. Next slide. This is just a pictorial of, various stages of the liver as the infection evolves. To the left of your screen is, light red, normal liver, soft, very consistent in terms of the echo texture. Then at the top, you can see when it's inflamed. Anything inflamed is bright red. If someone was to hit your hand right now, if your skin color is a bit on the lighter side, you will instantly turn red. And that's exactly what also happens to the liver during an acute infection. And then when that acute infection or the inflammation, the hepatitis settles, again, it regains it, like a light or soft red color. Sometimes that inflammation persists, and then you get what we call liver cirrhosis, which is basically now when there is, those fatty fibrous changes of the liver, and this can progress to hepatocellular carcinoma. And if you look at your screen, you can see where it's labeled HCC, the liver appears much smaller, which is usually the progressive consequence of liver cirrhosis, where you have a shrunk liver. The liver does reduce in size, becomes very hard, very fibrotic, and with time, it loses its potential to perform many functions. And the unfortunate thing with the liver is once your liver shuts down, once it shuts down completely, we can only give you, 48 hours to live. So you find that the liver is a very resilient organ. By the time the liver is shutting down, almost 90–95% of it is gone. So it's very resilient, unlike most other organs that, even with 50% effects, it shuts down. The liver really does try. It's a very hard worker amongst the body organs. So by the time it's shutting down, really, it's been overwhelmed, and within 48 hours, it's impossible to rescue that patient. Next slide. So for the diagnosis, as we've said, the only sure way is to go to hospital, access the right specialist who is going to be able to do the relevant battery of tests to be able to tell you whether your liver is okay or whether it's not okay, to be able to tell you have a viral hepatitis, which specific one do you have, can we treat it, or what is the next course of action. So 3 parts to that panel of tests. Are you infected? Number 2, are you protected because you are vaccinated, or are you protected because you've been exposed to it? And there are different kinds of tests that we can do to be able to tell that. Is your protection from, immunity you have acquired because of exposure, or is your protection because of a vaccine that you got? Because sometimes both scenarios can occur. And the third issue is this previous slide. Are you at risk of being infected with hepatitis B? So based on your immune status, what kind of risks are you exposed to hepatitis B and others? Next slide. So once you've been diagnosed, we've done the right panel of tests. We've been able to tell you whether you have an acute infection, a chronic infection, and other complications that you are exposed to. We are able to advise you on whether we will treat you or not, because you may test positive, but depending on how we assess your blood tests, we don't always treat. Sometimes we are at a point where you're testing positive because of previous exposure. And when we assess in terms of the viral load, the amount of virus in your blood, it does not meet the threshold for us to treat. So when that happens, then we are able to to give you options. Now, this might progress into chronicity, and this is the way we'll go about it. You'll be coming back for follow-up every so often so that you can check and make sure you're not running into complications. Or if the amount of virus in your blood meets the threshold for treatment, then we start your treatment immediately. So just for your general knowledge, the treatments fall into two major categories. There are those drugs that we call immune modulator drugs. So these are drugs that basically boost your immune system to be able to help you to get rid of the hepatitis B virus. Usually it's given as a shot, similar to how we give injections to our diabetic patients. And you get this over a period of 6 months to 1 year. For some patients, as we said, 90% will progress to recovery, but 10% progress to chronicity and its complications. The other class of drugs is antiviral drugs. Antiviral meaning drugs against viruses. So these are very many, and the choice will be made by your physician based on many things, including how your organs are functioning, what age are you, because you have a slightly different option of drugs for children vis-a-vis adults and so on. We will choose different drugs depending on, are you pregnant? Do you have any other comorbidities or other diseases that you're dealing with? That will determine which treatment we will put you on. But basically, the purpose of these antiviral drugs is to make sure that either we reverse that hepatitis or we slow down the progression to chronicity and the further damage of your liver. Next slide. In a nutshell, the treatment will be guided by your physician. This is not one of those things that you want to self-treat because it's very technical in terms of how we approach the treatment of hepatitis B specifically. So get to the right specialist, go to your specialist physician, go to your hepatologist, or any other that you will be advised by your primary healthcare provider for you to get the right guidance. As always, prevention is better than cure. We cannot overemphasize that. So get vaccinated. If you don't remember anything else from today's talk, remember to get vaccinated against hepatitis B. The consequences of hepatitis B, we might be talking about 10%, X number of thousands in the world, and you think, oh, that's such a small number. I'm very unlikely to get it. The problem with these statistics is if you are one of those 10% who are affected, for statistics and us sitting here and analyzing the scientific data, it just sounds like a small number. But when you are one of those people in the 10%, for your spouse, for your family, for your children, for your parents, it's 100%. So if it is something that you can prevent, just don't be the statistic, because at an individual level, that means everything to the people who care about you. So get vaccinated. It's a very simple schedule, 3 doses, you get 1. After 1 month, we give you your second dose. After 6 months, we give you your third dose, and you have protection for a period. And then we will advise you on when you can do your boosters. So as much as possible, go to your healthcare provider, find out how you can prevent this through vaccination. The vaccine is widely available in most healthcare facilities, including our hospital in Mata. So if it's your hospital of choice, do come in, talk to us, we see how best we can be able to get you protected. Other than this, the regular things apply. Of course, we've talked about generally, hepatitis A and E, which are fecal-oral. So all the basics apply. Wash your hands, thoroughly with soap and water, especially, after visiting the facilities, or if you've been exposed to, any blood, bodily fluids, especially of people who you don't know their hepatitis B status, just wash thoroughly to prevent, further exposure, especially to the mucous membrane. Sometimes you touch blood and then you rub your eye, and there you have mucous membranes that easily, can permeate some of these viruses. If you especially have either multiple sexual partners or even a trusted sexual partner and you do not know their hepatitis B status, please use protective methods, which commonly tend to be the barrier methods, commonest of which is the condoms. Do that, protect yourself from both hepatitis B, hepatitis D, and even the HIV. Avoid direct contact with blood and bodily fluids. This can be through various methods that I've already mentioned, and even including, society is changing. Some people may have friends who inject drugs and so on. People who inject insulin and you think because it's my relative, it's safe to share the same needle, please. No direct contact with sharps and objects that may have contact with blood and bodily fluids. Clean up any blood spills that may be in your environment. It might be an accident that happened. Someone was in the kitchen, they got injured with a kitchen knife. Always put some diluted bleach solution. Commonest, usually, most of us have jik in our homes or any other form of bleach that you use for cleaning. Pour it on the blood droplets. Usually it tends to kill any virus that may be there, and then proceed to clean. Whatever you clean with, if you can, discard it. Avoid using sharp items, including body rings, and make sure any sterile needles or anything used for body piercings, for those of us who usually have a preference for tattoos and body piercings, just make sure those are not shared. And if you have access to these, then just make sure they're clean and sterile. Next slide. So hepatitis lifestyle and nutrition tips. If you're diagnosed with this, how do you stay healthy? By eating right and so on. So the pyramid that is shown there at the top, showing what you should be eating in small amounts, and at the bottom of that pyramid, what we would advise that you can eat in generous amounts. So whole grains, bread, beans, pasta, nuts, fruits and vegetables, healthy oils like olive oil, canola, almond oil, and so on. All those being healthy things. This is actually not just for hepatitis. This is general advice for body health. It works very well in the context of hepatitis, but it also works very well in the context of any other non-communicable disease or the lifestyle diseases, as it were. So maintain a healthy lifestyle. Again, when you visit your healthcare provider, be sure to ask these questions so that you get the right guidance as to how best you can maintain a healthy nutrition, healthy lifestyle to be able to, deter progression to chronicity as much as you can. And if it is an acute infection, how to increase your chances of healing 100% and preventing complications from some of these infections. Next slide. So that brings me to the end of this pact, but I've tried to simplify the message as much as possible, and I hope you can now define hepatitis. When someone tells you I have hepatitis, you're able to have an idea. You now have an idea of what that means. The symptoms, I hope you can tell whether your symptoms or something you've been experiencing, a friend, a family member. Could it be viral hepatitis? I hope now you can be able to tell that this chronic fatigue, is this something that we need to rule out? This yellowing of the eyes, why are your eyes suddenly turning yellow? You're able to suspect that this could be an issue with the liver and maybe we need to get you tested. You're able to know how to get tested, who to go to, even for testing of this viral hepatitis. I hope that you now have a basic understanding of what treatment options exist. As we've said, sometimes we treat, sometimes we don't, depending on the amount of virus in your blood. And even when we treat, we could give you antivirals or we could give you the immune modulators just to help you not progress to chronicity and further complications. Most of all, I hope that you're able to tell at a basic, minimum, how to prevent hepatitis A by, washing your hands, preventing transmission through contaminated food and water, hepatitis B and D, through blood and bodily fluids, unprotected sex, hepatitis C, and so on. So how can you prevent yourself from getting it? And most of which we've said, you need to get vaccinated against hepatitis B. And if you have it, how do you live a healthy lifestyle? So that brings me to the end. I think I'll throw it back to you, Jessica, for any questions that may be there. As a parting shot, remember, you have one liver and one life to live. Unlike the kidney that comes in twos, just with one kidney, you're able to function properly as far as your kidney functions. And that's why when your kidneys shut down, we just give you one kidney and you're able to, reverse back to full function. The liver is just one. So once you, damage your liver, there is no spare. There is no spare in the body. And the liver transplant is one of those things that we have not yet started doing in our country. The closest you can have a transplant done is in the down south or out of Africa, if that's not an option. The cost of which is very expensive. And because it only exists as one, this will be, a cadaveric donation, basically donation by somebody who's been declared brain dead or who's died a sudden death. So you can imagine it's very hard to get a liver. So protect yourself as much as you can, because sometimes even with the right amount of money, you may not be able to save yourself once you damage your liver. So one life, one liver, protect yourself as much as you can. Thank you.
Thank you so much, Dr. Olive, for that very informative and interesting session. Before we go to Q&A, we are going to just launch another poll to see how well we have understood our session for today. Kindly. So I'm going to share this with you so that you see where you are in terms of the information that we have been given today. And the question is, which is more infectious, according to what Dr. Olive has just taught us, hepatitis B or HIV? Well, the results are very encouraging. It means we've been very attentive. Dr. Olive, most of us know that hepatitis B is more infectious than HIV, so the class has been successful. We will do another poll, but as we do this one, let's all also send our questions to the chat session, so that the doctor can be going through them as we do our third poll. Our third poll is, how can you prevent the spread of viral hepatitis? And there are multiple choices, so choose all that apply. All right, the answers are back. Dr. Olive, maybe you can tell us how well we've done as we open the floor for the Q&A.
I can see most people have answered well. I'm not sure why many of us did not check cleaning up blood spills with fresh diluted bleach solution, because this, as we said, is one of the things that actively kills the virus. So just as a reminder, if you have any blood spills, either within the office, within your home environment, wherever you may be, either because of a car accident, or someone has nose bled onto a surface and so on, pour diluted bleach solution. If you're not able to dilute it in real time, pour the bleach solution as it is. At least try and prevent that virus from remaining, alive and active enough to cause an infection. So just as a reminder, so all those answers actually were amongst the things I listed as, what you can do or how you can prevent the spread of viral hepatitis.
All right, thank you very much, Doc. We're going to go to the Q&A session. If anyone has any question, you can type in or unmute yourself and, go ahead and ask. Any question?
Good morning, everyone.
Good morning.
I have a question. Initially, I had a problem while joining, and I missed what is hepatitis and what causes hepatitis. So I'm requesting Madam Olive to do a recap, please. Thank you.
That is okay. Thank you, Julius, for that. So hepatitis, what we said is basically a medical term that you can divide into two. Hepa in medicine basically means the liver. Itis means inflammation. So hepatitis is inflammation of the liver, very basically, to put it so. So inflammation of the liver, which can be caused by many things. including direct injury or direct trauma to the liver. Sometimes you can have a blind or a closed injury to your abdomen that can cause inflammation of the underlying muscle and underlying tissues and organs. That can cause the hepatitis or the inflammation of the liver. Other things that we talked about, especially in our setup, we did mention alcohol use or abuse, which is just basically overuse. And overuse, is relative. What is overuse for one person might be allowable for another. But one of the very known and very common causes of liver inflammation in our setup is that particular insult due to alcohol use. Another one that is slowly becoming very common is being overweight and obese, contributing to what we call non-alcoholic liver inflammation. That again, a known cause that is fast growing due to the overweight and obesity epidemic in Kenya right now. The other things are organisms, and we listed things like bacteria, parasites, and viruses. The focus of today's discussion was the viruses. The viruses that specifically attack the liver, which are 5 in number: hepatitis A, B, C, D, and E. Of those, the most virulent and the most serious is the hepatitis B infection due to its direct association with liver cancer. So in a nutshell, that is what we mentioned. I'll be happy to share a PDF of the slides through Jessica, so you will be able to also go through that at your own time. Thank you, Julius.
Welcome, Dr. I'm grateful.
Thank you. Any other question? Please feel free to ask or chat. Okay. So if there are no other questions, I'll take this opportunity to invite Victor Otieno to say a vote of thanks as we close. Thank you. Welcome, Victor.
Thanks, Jessica. I believe I Great. Mine is just to thank Dr. Olive for the great and informative session. I believe all of us have learned one or two things about hepatitis, and just to also appreciate you who joined the session this Friday, and also like to appreciate the team who was in behind organizing and arranging this session. And mine is just to say thank you. With regards to other nitty-gritties, I can see guys are informing who joined a bit late. Maybe Jessica, on the other hand, can share the slides as well as the recording. Thank you.
Thank you, Victor. We will definitely be sharing slides. Thank you all for taking time out of your day today to attend our session today. Thank you, Dr. Olive, for a very informative and engaging session. We really do appreciate. To all attendees, again, I want to say thank you. Maybe we can close with a word of prayer. Thank you, Father, for giving us an opportunity to attend this webinar today. Thank you for everything that we have learned. We're asking you to be with us for the rest of the day as we go on our business. Be with us and our families. Bless all the work of our hands. We thank you, we praise you, we worship you, and we glorify your holy name. In Jesus' name we pray. Amen. I wish you a great day ahead. God bless you all.
You
Thank you.
too.
Thank you very much.
Thank you.